This is the award-winning Lee Pitts Live.
This portion of Lee Pitts Live is brought to you by Lee Memorial Health System.
Southwest Florida, welcome back, and we're so thrilled to be here at Lee Memorial Health System. And without further ado, we're going to get right to it with our first guests, who are significant figures in the Southwest Florida landscape. We have Jim Nathan and Yemisi Olarantola Coates. Let's bump you in.
All right. Yeah.
And Yemisi and Jim, I want to thank both of you for the outstanding accommodations that Lee Pitts Live has received here on the Lee Memorial Health System property.
Well, Lee, we're honored to have Lee Pitts Live right here at Lee Memorial Health System.
We're glad to be here.
Yes, very honored.
Okay. We're so thrilled. Jim Nathan, tell us where we're physically located in the Lee Memorial Health System.
Well, we're
hospitals.
actually in the Lee Memorial Health System Board of Directors room, where they meet a couple of times each month, and it's open to the public.
Now, that Board of Directors is very important. They are very important to the overall health system care in Southwest Florida, would you say?
Yes, they are selected by the citizens of Lee County to be the stewards of Lee Memorial Health System, and they're elected similar to a county commission election or a school board election. It's countywide election.
Differentiate a public hospital from a non-public hospital. This is a public, Lee Memorial Health System is a public hospital.
Right.
What's
We're
the
created by the state of Florida as a special unit of government, and we are not governed under anything other than the enabling legislation the state created for Lee Memorial. So we don't look like others. The others usually have local tax support. We don't have any local tax support, but we have to abide by sunshine laws and public records laws, and have a open meeting and open records process.
Excellent. Yemisi Olarantola Coates, of course, you're the Director of Diversity and Inclusion for Lee Memorial Health System. How has that changed over the last 10 years?
Wow, well, it first started in 2004, and that was through the leadership of Jim Nathan, John Cecil, and Christy Riggett. And that's when they brought in a manager of diversity, and that is when they started language services. So if you look 10 years later, our presence and the things that we're doing today as it relates to, we've seen a substantial increase in minority employment within Lee Memorial Health System, both all over within the system in general and in management as well. Also, our community initiatives, those are things that I love being a part of, and the presence of that Lee Memorial has within the community, whether it's leading an initiative or supporting one. And so I think 10 years later, and there's a whole host of things that I can add in between, but I think we're going strong, and there's a lot more to do.
Outstanding. Keep up the good work. We see you all over the community making a difference. Jim Nathan, congratulations, by the way, on receiving the NAACP Image Award here in Lee County branch the other night. That was
very nice.
It's a great event. You're well deserving of that. Just you in general, you just seem to be able to just fit in all types of communities. Even though you have a powerful position here in Lee County, you seem to, everybody, I know you don't think so, but I've never heard anything negative about you. And my point is, what is it about you that allows you to be able to fit in so well in all different communities?
I just, my entire life, I've always believed that I'm just one person, and we all are, and that we need to come together. I believe in peace, I believe in trust, I believe in collaboration, and I try to exemplify that in what I do. But I think good things help to breed other good things, and try to accentuate the positive.
A position like that Yemisi Olarantola Coates has at Lee Memorial Health System, that wouldn't exist without a person like you blessing it. You're proud of that type of department here as well?
I'm proud of what Yemi has done. I'm proud of what our organization has been able to do. The outreach is phenomenal. Yeah. There's always more. There's always a need to do more, and each day we try to figure out how we can play a role in helping our community be stronger. Affordable
health care, also known as Obamacare, it's just peppered throughout the news over the last few years. How is that impacting Affordable Health Care Act impacting our area?
Well, obviously it's been very politicized. But the basic goal was to try to get individuals covered with health insurance in our community and across the nation. And that's a very important goal, to do that, because when people don't have health insurance, they often wait way too long to access health care, and it costs a heck of a lot more. And it's not free because somebody's paying for it. So the goal of the Affordable Care Act is very laudable. There are some challenges with it politically. It's very, very complex. But one of the good things is that we've seen a stabilization, at least for individuals that are with 100 to 400% of the federal poverty level, now have more affordable health care, not free, but it's on a sliding scale basis based upon their income. The challenge in Florida is that we're one of the states that has chosen not to participate in the people that are mostly low income but still working individuals that won't qualify for Medicaid and don't qualify for the subsidized insurance. And that's a problem. It's about 800,000 people in the state and about 35,000 right here in our own community.
Well, tell us how your partnership or your work with United Way Houses and Lee Community Healthcare, and how all of that comes together in terms of looking out for the underinsured and the uninsured.
That's a really wonderful program. We've been approved we're one of the first in the country to get approved of what's called a federally qualified health service lookalike. And what that means is that we can participate in some better Medicaid improvement where we can offer services to the uninsured. And in doing that, we've done it in partnership with United Way and many other community organizations. And it's that tie-in of social services, human services, and health services. And traditionally, if you have a clinic that just is doing medical care, but you don't have the support systems, you're not doing a service for the people. Or if you have a human services program, but you don't have the medical care. So that tie together, the coordination, the communication has been phenomenal. And so all of our programs, we're trying to do them in collaboration with human and social services, and United Way has been a great partner.
Outstanding. Now, Yemisi, in your capacity, a lot of the things that Jim just enunciated, how does diversity and language services marry with what's going on? Do you have to make sure that you cover that piece as well?
Absolutely. Definitely in terms of, if we look at language services, for example, making sure that we ensure that there's effective communication between the provider and the patient. And so through having staff interpreters, we utilizing technology. We have video remote interpreting that will soon be in all LPG sites. And that video remote interpreting includes all languages such as Spanish, Haitian Creole, but also sign language.
I see.
So that's the latest technology that you'll see in the next couple of months. Another thing is cultural competency education. You know, one of the things that the Center of Disease Control focuses on is the social determinants of health. The Lee Community Healthcare deals directly with the social determinants of health. Social determinants of health, what it says is that there's certain things socially that happens to that individual that impacts their health, whether their income, their education, where they live, certain psychosocial things that happen to that individual. And so having elite community health care, having diversity and language services, which I do provide a lot of extensive training and education for staff, helps to ensure that when they walk through our doors, we have that holistic understanding of the individual, where before in the past used to be just treating the disease. Now we're treating the whole patient because there's more to the story.
Now, how does equity and equality differ, and how does it fit into the healthcare process?
Thank you for that. The AHA.
You're making me look smart.
Well, thank you for that. Well, I recently attended a conference in the AHA, American Hospital Association, and they were talking about equity of care. And there's a difference. The definition of equality is everybody's the same. So for example, if we have a short person, a tall person, and a middle height person who's trying to see a baseball game over a fence, and you give a box for them to see the game. But if you notice, the tall person is already tall enough to look over the fence. The middle-sized person probably needs that extra box to look over the fence, but the short person can't see. He can't see over the fence. What equity does, it accounts for the variations, the uniqueness, and the individuality of those persons. So the tall person doesn't need a box. The middle height person needs one. the short person needs 2 blocks so then everyone sees the game. So in healthcare, what we try to do, such as facilitate communication, that's one of the ways. So we want to make sure that whatever the uniqueness or the individual needs presented by the patient, that when they come through our doors, we understand that and apply equitable care, because everyone is not the same. There's differences and variations that are crucial and important, particularly culture. We have to take that into account, because how one views the disease in one culture is going to be very different than the other.
There's a lot to think about when you're dealing
Absolutely.
with healthcare. And one of the things that you educated me on that I never even thought about is just when somebody comes into the emergency room or anywhere in healthcare, I just assume everybody speaks English, understands English, but when you want to know people's blood type or whatever questions you might have to ask them, you got to speak to them in their language. And when you were telling me that, I was like, I never thought about
How many
all that.
different languages
Yes.
do we have in our system?
Oh my gosh. Well, our top 4 languages is definitely Spanish. Second is Haitian Creole. Third is German. Fourth is sign language. But on any given day, because we are a destination site, we can see within the health system, particularly let's look at Gulf Coast Hospital, 30 different languages in a day. And from Farsi, Arabic, Tagalog, Japanese, you name it.
Amazing.
Yeah.
A lot going on there. Now, Jim, one of the things I never think about, again, I'm just a conscientious observer, is that when population growths happen, I just figure everything gets taken care of. You know, they expand the freeway or how we expand some roads. I never thought about the impact that could have on the healthcare system. Now, here we have a double whammy, don't we, in the sense that we have population growth, we have people who age out, who come here a lot, older people and retire here. How does that impact the
Well, you're more than
our-
just an
right.
observer to be able to say that. And the reality is, over the last few years, we've had unprecedented growth into our community. We tailed off a little bit when the economy tanked because people couldn't retire or sell their homes. But we're clearly a service economy servicing retirees. So that retiree population, heavily growth in the senior end. Seniors use health care twice more frequently than non-seniors do. The bodies are breaking down. And so they need health care services. As a nation, we're moving more and more to outpatient services. But with our growth, especially in that senior population, we still need hospital services. So we're doing a massive expansion here at Gulf Coast Medical Center. So besides our children's hospital that we're building, we're also going to add 275 beds right here at Gulf Coast.
What would be the impact of that on the city of Fort Myers?
On the city of Fort Myers, it actually could be a good thing because we'll free up some space at Lee Memorial, be able to bring even more community programs to Lee Memorial Hospital, and be able to service the city even better.
Excellent. Now, Yemisi, when we see you moving around the community, we know that you're a part of Lee Memorial Health System, but you seem to get involved with a lot of boards and things of that nature that are not necessarily health care, or do within that structure you will always find a health care concern that you can address?
Oh no, I think one thing that I love working at Lee Memorial Health System, everything is tied to health. Remember, the CDC talks about the social determinants of health. So if I'm going to a meeting talking about, let's say, violence or economics, that does affect health. If I'm going about education, that does affect health. And Lee Memorial understands that. They're one of the few hospitals that I see, in my opinion, that really truly understands the importance, and not just me, because there's a lot of us out there in the community doing various things, sitting on various boards, participating, supporting on a whole host of levels, because we understand we are a community hospital. So we understand as a community hospital, we have to take care of our community. And that is why you see me, but not only me, a whole team of us out there contributing our time and our efforts to make sure that those areas, because that's just as important, because it all connects and is ties to health.
As the more I learn about Lee Memorial Health System over the years, Jim, and Leap is Live is grateful to all the work we've been able to do together at Lee Memorial Health System. I've learned that we are fortunate in Southwest Florida to actually have a hospital concern like this that actually is involved in the community in that way. Coming down from the top, from you as CEO, is that something that you're always conscious of? Final question, by the way.
Absolutely. It is critical that we be a strong community partner. We can't do this by ourselves. We've been heavily involved in the foundation of the Healthy Lee initiative. And really, it's not a Lee Memorial Health System. The whole community has to be focused. Get up and walk, get your body moving, keep the cobwebs from growing, and you can be a lot healthier.
Okay, well, let's bump both of you out.
All right.
Yeah, all right.
Appreciate the accommodations.
You're welcome.
Okay, stay right there. As the saying goes on this particular show, for those who say it can't be done, They are usually interrupted by those like all the fine people at Lee Memorial Health System, like Jim and Yemisi, who are doing it. We'll be right back on Lee Pitts Live.